Singh. She is a dermatologist and head of Department of Dermatology. Current affiliation is Government District Hospital.
Very good morning to one and all.
May I to you, Dr. Aditi.
Very good morning to one and all.
Or is mic?
Hello. A very good morning to one and all present here. Am I audible? So today, my topic for the day is fillers, benefits, risks, and patient selection. And at the outset, I'd like to thank the organizing committee of Team EZCON IMS for inviting me here. When you look at these pictures of a beautiful lady, the one on the left versus the one on the right, can you guess what age she is? It's the same lady, but the left one may be late 30s or early 40s, and the right one may be early 30s or maybe maximum 35, if you concur with me. So that is not AI, that is actually the beauty and the magic of fillers. So as Tabassum ma'am has already highlighted very well and beautifully the etiopathogenesis of menopause and skin changes, I will not be going through that. However, the important thing is midlife is essentially the age bracket of 40 to 65. And all of us know that collagen levels drop and hence it has an effect on the skin. And ma'am has also explained how a youthful face goes into an aging phase due to certain gross anatomical changes as well, like fat pad atrophy, and due to loss of collagen, the muscle tension and the connective tissues regress, all of that leading to sagging of the face. So when we see from 20s to 60s, this phase, we find on the forehead wrinkles, lines. If we see in the periorbital area, we'll have puffiness of the under eye area, pigmentation, crow's feet. Then further down, we have a deepening of the nasolabial fold. Then the formation of jowls. Then the drooping of the angle of the mouth. So all these changes are more and more evident as we progress towards the 60s. Now, anti-aging modalities are many, but due to paucity of time, I will be covering few of the, just one in fact, of the procedural anti-aging modality. So as ma'am has highlighted, there is botulinum toxin, there is chemical peeling, fillers, PRP, lasers, IPL, radio frequency, etc. I will be talking about fillers. So what are fillers? Fillers are basically biocompatible gel-like substances injected beneath the skin to restore lost volume, smoothen out wrinkles, and enhance facial contours. So they are essentially made of the substances which are already present in our skin, like hyaluronic acid, collagen, poly-L-lactic acid, calcium hydroxyapatite, polymethyl methacrylate, autologous fat. The thing that we have to really remember here is we inject fillers to augment soft tissue, restore the volume that is getting lost with age, and we do it to enhance facial contours. Coming to benefits of fillers, in the first picture you can see it's of a male patient and his nasolabial fold in the left picture is more prominent, and in the right picture it has softened out. So it gives him a more youthful appearance. Second picture, I have treated the dark circles here using the fillers in the under eye area. So as you can see from the left to the right, the patient looks younger, more youthful, and fresher. Third picture we have, I've already discussed earlier. So the under eye area has been corrected here. The nasolabial folds have been injected. So overall, she looks literally from her early 40s to her maybe mid 30s. The last picture, again, we have done the nasolabial fold correction using fillers. And if you can see a subtle improvement in the drooping of the angle of the mouth. Like every other invasive procedure, dermal fillers have their own complications. I will be highlighting only the important ones here. So this is the most frequent complication. Anything that you inject, there could be an immediate redness, So this is basically due to immediate allergy of the substance injected on the face, or even sometimes due to the EMLA cream that we apply prior to the procedure. So this is nothing to worry about. Patient is counseled and icing is to be done, that's all. The second one looks a bit scary, but this is basically bruising. So due to puncturing of a blood vessel, and this presents as discoloration in the area injected. This may present immediately to a few days after the procedure, and this is largely benign. The patient has to be counseled, avoid heavy exercises, avoid facial, etc. Within 2 to 3 days, 2 to 3 weeks, it resolves. The next complication is actually an emergency. So in case we inject inside the vessel, so this is an intravascular injection leading to a vascular compromise, and it leads to ischemic necrosis. This is an emergency and has to be treated immediately with hyaluronidase injection. And the patient will present with pain, discoloration. The next image, and I just forgot to mention, we can largely prevent vascular compromise by aspirating before injecting. The last picture here is patient presents with a painful nodule. This is an infective granuloma. There will be pain, tenderness, rise in temperature, and the patient has to be put on oral antibiotics and anti-inflammatory. The next complication is basically an aesthetic complication and something that we've all seen over the years, and it's self-explanatory. It is when fillers are over-injected. So many times it is due to the patient asking for more and more and more. So the patient's psychology and history has to be understood thoroughly to avoid this complication here. Which brings me to patient selection. So a thorough patient history has to be taken before the procedure. The patient's psychology and expectations have to be understood, what the patient wants, and the patient has to be made to understand what we can actually deliver. Also, a 60-year-old patient cannot be made to look like a 30-year-old. Medical comorbidities if the patient has had a prior history of maybe anxiety or angina or any other surgeries. Contraindications include active infections, recent history of herpes, uncontrolled diabetes. So these are all obvious contraindications. Bleeding disorders, autoimmune disease, keloidal tendency, known allergies, pregnancy, and lactation. So this brings me to the end of my presentation. So fillers are great, magical. They make you look younger and beautiful. But the real thing, the takeaway of today is, the real thing all of us need to do today is fill up our lives with peace, joy, and positivity. Thank you.
Much, Dr. Aditi. Very engaging presentation. I just have one question. What is the role of collagen? Are we supposed to take it in any form like we are in our 30s and 40s?
Ideally, we should all start taking collagen supplements in our mid to late 30s, because that is when the aging process begins. So it will retard it to an extent. It won't reverse it, obviously.
One more question, ma'am.
Yes.
What is the role of collagen at this age?
So ma'am has just asked that. Yeah, so collagen will help with improving the skin elasticity, reducing the appearance of wrinkles.
Or supplements?
No, supplements.
So you suggest that aging women should take all skin treatments and look beautiful?
Yes, I feel that an aging woman can go for this procedure. However, as I said, patient selection is very important.
And what about sunscreen? Like how much to apply?
And I believe that is a topic, a totally different topic that we can cover in my next presentation, in your next conference.
Thank you so much for throwing light on this part of menopause treatment. And definitely, it somewhere impacts women life. So we should know little, at least little. Obviously, we are going to refer to you only, but at least for counseling part, we should know something about the fillers. So thank you so much.
Most welcome. My pleasure. Thank you all.
Now I would like to bring for the capsule 3, Dr. Rajni Sahu ma'am, for the third speaker. She's a senior gynecologist.